While pregnant, McKenna Lauterbach developed a persistent cough that led to the discovery of a large tumor in her chest, causing severe respiratory distress. She was flown to Northwestern Memorial Hospital, where a team of specialists provided urgent care for both her and her baby.
The tumor was about 12 centimeters, which is roughly the size of a grapefruit, and it was sitting right on the heart and extending into the right lung.
So we think at some point she may have had a melanoma on her skin. Her own immune system took care of it, but not before a cell or two may have escaped and then eventually started growing inside her body.
We may see this once a year, may see this once every 5 years. And sometimes we're not sure if the melanoma started in the chest or whether it came from somewhere else. And it is a very difficult diagnosis to make, in particular for her, because a lot of the tumor was dead tissue or necrotic. But it's extremely rare.
When you are pregnant and have a big, full uterus with a baby that's nearly full term, that keeps your lungs from being able to function in the way that they should. And when you add on top of that, this new tumor, at the time we didn't know what it was. We knew that something was not right. And when you add on top of a tumor to a pregnancy, you run the risk of really having respiratory collapse or cardiorespiratory collapse. And she was in real trouble. So we had to act really quickly. This was not something that could wait for a Monday morning. We had to really get it done that night.
Because McKenna was at a high risk for cardiorespiratory collapse, Dr. Lynn M, maternal-fetal medicine specialist, performed an emergency C-section.
We organized everybody into 2 operating rooms and were able to do a successful cesarean birth with the help of our cardiac surgery teams to prepare McKenna in case she didn't do well with surgery. Fortunately, she did really well and she recovered from her C-section, but it was still an eventful night with a lot of need for quick decision-making and lots of teams talking together to come up with the best possible care plan.
After the delivery, Dr. Kalvin C obtained a sample of the tumor with advanced bronchoscopy and was able to diagnose McKenna with stage 3 melanoma.
So the mass was right here, and it was attached to multiple important structures. The main trunk of the pulmonary artery, the artery coming from the heart going into the lung, was involved completely. It extended down the entire artery to the various lobes, so all 3 lobes were involved, which is why we couldn't save any of it. But mostly it was involving the right upper lung.
Dr. Long reached out to medical oncologist Dr. Sunandana Chandra for options to help shrink McKenna's tumor before surgery. Northwestern Medicine was part of a nationwide clinical trial that helped researchers discover that pre-surgical immunotherapy can improve surgical outcomes for patients with advanced melanoma. Dr. Chandra recommended that McKenna go through 3 cycles of immunotherapy before surgery.
So after 3 cycles or 3 doses of immunotherapy, once McKenna was taken to surgery, the surgical specimen actually showed absolutely no melanoma cells that were viable. So having achieved a complete pathologic response was the best case scenario that we could have hoped for.
McKenna received 3 cycles and was successfully treated. She will continue immunotherapy treatments for 1 year.
Her scans show no evidence of metastatic melanoma, and the hope is that with continued close surveillance with scans and visits, etc., that will continue to be able to show that she has no evidence of disease.
You know, it really brings tears to my eyes to see how well she's doing. I'm so amazed by the care she's gotten well after pregnancy and how well she's doing and how well she's responded to therapy. And getting to see Coulter as a thriving baby at 6 months old is amazing. It just really makes you impressed to see what can happen when you get all the right teams together and how families can thrive.